how many types are there of urticaria? Anyone? Is there any type of urticaria? Yes, there are 3 types of urticaria. One is acute type of urticaria, one is chronic type of urticaria, and third is inducible urticaria. Now, what is acute urticaria? Clinically, we see that if the patient is suffering from skin allergy, and if it is less than 6 weeks, or we can say less than 1.5 months, then it can be considered as a acute urticaria. That is theoretical differentiation. If patient is suffering from allergy or urticaria more than 6 weeks, then it is considered as a chronic urticaria. I would like to share some photos of urticaria. Can you see this, guys? In my initial practice, I used to take photos of urticaria. And in my initial practice, I show that is before after photos of urticaria in my practice. But when I realized कि पेशेंट आता है और 1 घंटे के बाद उसके इरप्शन चले जाते हैं, so there is no meaning to show before after photos of urticaria. The skin specialist can make a fun of you when you upload a before after patient photos of urticaria. Are you getting my point? So never upload your photos on social media of urticaria, before ke photo or after ke photo. That can be a blunder, that can be anything. So galat bhi ho sakta hai, but this is the photo of urticaria. Can you see the eruptions? Those are elevated in the left side photo.
Yes, sir.
Yeah, that elevation is urticaria. Can you see this photo? This is the typical urticaria patient. The eruptions are elevated, eruptions are round and oval. Even we can see the redness on the skin. This is a typical urticaria patient. Elevated eruption, and in some cases, when you touch the part, that can be hot, that can be warm. Even patient can feel warmness on the particular part. This is the case of mosquito bite. I would like to say this is the case of honeybee bite in the age of 4 or 6 months baby. This is a 6 or 7 month baby. जिसके अंदर बच्चा get the honeybee bite, and simply prescribe Apis. We have a wonderful remedy that is Apis, and it works excellently. इसके फोटो तो
In which potency, sir?
Generally, potency is a very big and huge topic, but yes, I would like to clear your doubts. In my practice, when I'm selecting the remedy on basis of physical symptom, then I prescribe on 30 and 200 potency only. And when I'm selecting it on basis of mental picture, I'm selecting it on higher potencies, that is 1M, 10 MCM. This is the basic concept what I follow in my practice. Basically, we are following such things since 40 years in our practice. So no other susceptibility we are following, no other criteria of selecting potency we are following. Those doctors who are coming over here, they know the way we are practicing. This is the typical urticaria. Yes, elevated eruptions होते हैं, redness होती है, and never leaving a trace behind. This is the key of urticaria, guys. Remember, just keep it in your mind, and that will help you to differentiate from any other condition. Any doubt till now, guys?
No, sir.
Okay. Now, acute urticaria. Less than 6 weeks, if patient is suffering from allergy or urticaria, that is considered as a acute urticaria. Now acute urticaria के causes कौन से हो सकते हैं, उसके triggering factor कौन से हो सकते हैं. तो one is viral fever next. In pediatric patient, when patient is suffering from viral fever, the associated viral fever, we get the patient of allergy. We just get the patient of urticaria. That is the triggering factor. Fever with urticaria. In pediatric patient, sometimes worm infection is one of the cause behind the urticaria. Even in case of UTI, patient also is that they are suffering from allergy. Even due to dental infection, we are getting patient of urticaria. These are the common clinical acute condition. Along with that, we are seeing the patient of urticaria. Generally, this kind of eruptions, this kind of urticaria is seen during the condition or after the 15 days or within the 15 days of that condition. Patient आपके पास आएगा कि मेरे बच्चे को 15 दिन पहले बुखार आया था, and then after 15 days or within this 15 days he gets eruptions. उसको ये सीरस की तकलीफ होती है, हाइव्स की तकलीफ हो रही है. Serious is Gujarati word, that is the common terminology used for urticaria in Gujarati. Any other terminology is famous in Rajasthan or Maharashtra or somewhere in your proper state? Anyone? Urticaria, hives, serious, allergy, any other terminology you know? That will be a learning for us. In your state, any specific word is used for urticaria? No, that is called as allergy only, right? Serious is the term that used in Gujarati. आपके पास गुजराती कोई पेशेंट आएगा तो he used to tell you, सर मुझे सीरस हुआ है, मुझे सीरस थયું છે. That is the condition, that is urticaria. Now,
Sir,
yes, anyone?
in Meghalaya, it's called Nyangmi.
What is that?
Nyangmi.
Yumly.
Nyangmi.
Yummy. Okay. I'm very poor in pronunciation. Okay, in which state this word is used?
Meghalaya.
In Meghalaya. Yummy.
Yes.
Right?
Nyang.
Yummy. Okay. Learning for me. In last session, I learned chia. Chai, that is chai. Chai is used for alopecia areata in Maharashtra, in Marathi language. And this is the new word for me, that is yummy or yummy.
Nyang.
Yum. Okay, yummy.
Nyang.
Yum. Quite difficult to pronunciation.
Okay, sir.
Another cause of acute urticaria, that is medicines. When patient came to you for acute urticaria, make a habit to ask the patient about the history of the previous 15 days. अपने last 15 दिन में, have you ever take anything which you are not taking frequently? You can ask like this: have you experiment with yourself with any new thing since these 15 days or before you have 15 days? Then and then you will get to know. Or sometimes patient is not aware that he took pani puri yesterday, but when you ask her or him, he realized, yes, I took pani puri yesterday, that I'm not taking daily in my routine. I took a sabji of that brinjal yesterday, and that might be the cause behind that urticaria. Clinically, we have seen that sore things, that is the culprit. Clinically, we have seen that the things having small seeds, like tomato, like brinjal, like ladyfinger, these are the most commonly triggering factors of urticaria. Peanuts are also the common triggering factor of urticaria. You can ask directly to the patient कि इसमें से कुछ खट्टा खाया था आपने? Have you taken anything खट्टा before 2 days or within these 2 days जब से ये शुरू हुआ है? You can ask like that कि ये भिंडी खाई थी, ब्रिंजल खाया था, anything you have taken that small seed contained in that sabji and that vegetable. Yes, dairy products are the common factor. These are the common triggering factor कि जिसकी वजह से एलर्जी हो गई है. तो you can ask directly to the patient कि ऐसा कुछ लिया था, कुछ खट्टा खाया था. Even pickles are the triggering factors. आपने pickle खाया था. And if you are asked direct question, and if already patient took it before 2 days, he creates some confidence in him that you know about the disease, you know about the particular condition of the patient. So make a habit to ask the question like this, the patient of urticaria. Medicines, आपने 2 दिन पहले कोई पेन किलर लिया था? Have you ever taken that painkiller within these 2 days? कोई injections लिया था? Have you go through any report and that report contain any dye? Dye is injected in the body and that dye can create urticaria or allergy. So have you gone through any such kind of reports within these 2 or 3 days? Within these 15 days? As we already discussed, food are the triggering factors. So we have lots of medicine in our materia medica. Those creates aggravation. Synthesis repertory के अंदर there is lots of medicine is mentioned. Lots of food particles are mentioned. Banana aggravate, this mango aggravate, and all those such things. So that particular thing we can give to the patient. That is not going to cure to the patient, but yes, that helps the patient. Definitely, we can give those medicine that particularly created by such thing, and the medicine is given in our repertoire. Insect bite is one of the cause के जिसकी वजह से acute urticaria is seen. Physical factors are also there, like chemical, sanitizer. Those people are not used to do in daily practice, and when they came in contact with that chemical, that creates acute urticaria, acute allergy. Any kind of chemical that can be. एक soap भी हो सकता है, that can be a dishwasher liquid भी हो सकता है, anything. Latex भी हो सकता है. Latex किस में होता है commonly? That is
Gloves.
Gloves and contraceptives.
most commonly seen in condoms and gloves. So कोई भी doctor आया या कोई भी anything, you can directly ask. If you are not getting any factors, कोई latex के contact में आएगी. Latex are very common allergic condition that creates allergy. Are you with me, guys?